In the Crossfire tonight, Democratic Representative Loretta Sanchez and Republican Representative James Langford. And let me start, Loretta. California is an interesting case study. About 37,000 people signed up through the California website. But yesterday, the Commissioner of Insurance indicated that 1 million Californians are receiving notices that their insurance is terminated. Now, if you have 30 times as many people getting a notice as you have signing up, as a Californian, doesn't it concern you that January could turn out to be a real mess at the rate things are going?
Well, certainly I'm glad I'm a Californian, because in California we definitely adopted Obamacare. We said, let's make this work. We have an insurance commissioner, Dave Jones, that wants to make it work. We have Covered California. I actually went into Covered California, and guess what, Newt? I found out that the policy that I get through the federal government is just $1 different than the policy that I would get under Covered California. Unfortunately, as a congresswoman, I don't get to go into California's exchange. I'm being forced into D.C.'s exchange, which I didn't know, but, you know, that's what OBM or whoever the personnel office decided for us. All I want to say is that, yes, I am completely concerned about people who have policies now who are getting these termination notices. By the way, the ACA, the Obamacare law, didn't actually grandfathered people like that who had policies to be able to keep them. It didn't grandfather what companies could charge you for that policy, because in the last 3 years, I've seen the companies in California for individual policies try to do 34% increases a year, 43% increases a year, 23% increases a year. And I was the first one to send a letter to them, to call them in, to talk to Blue Cross Blue Shield and say, listen, these are unacceptable. You keep doing this, you're not going to get a chance at those new people.
There are new provisions in place to make sure that they can't take advantage of.
So, you know, they were going to increase anyway, because those policies that these people have, they're obviously not making money on them.
Let me just ask one question. What happens, we got into this discussion today, and I don't know the answer to this. What happens if somebody ends up on January 5th in a hospital, thinks they have coverage, don't have coverage, and you know it's going to lead to a lawsuit? So do they sue the federal government? Do they sue the state of California? Do they sue the insurance company which dropped them but no longer has them? I mean, when you have a big gap of 1 million lost policies and 37,000 so far signing up, you're probably going to have a couple 100,000 people without insurance in January.
Well, first let me tell you something. The number is significantly higher than 37,000. It's embargoed right now. I heard it this afternoon.
Of the people signing up
of the people who have signed up in California. It's in the hundreds of thousands. I will just tell you that. I have in my own district done at about 20 forums and telephone forums talking to people about whether they would go into Medicaid, what they're going to do with Medicare, even signing up for Medicare. You know, my mom's a Medicare person, right? And she called me and she said, how do I know? Can you help me know which is the best plan in Medicare? I'm like, I don't know, Mom, but let me get you a specialist on that. So they do have specialists. We do have people. The problem is we need to get the word out. We need to drag people in. And, you know, I shop online once in a while. I put the thing in the cart. I don't come back and buy it until days later, sometimes a month later. It's still sitting up there. I know there are a lot of little shopping carts in that Covered California that have a plan in there. You know, if you don't have to pay for it until December, why would you pay for it today?
Right. And isn't there a reality to this, too? So we saw under Medicare Part D that there is a slow ramp up. Your mom was probably one of them in terms of signing up for prescription coverage. People waited until the end and signed up. We also saw this in Massachusetts, which, you know, as you know, Obamacare is modeled after Romneycare in Massachusetts. And take a look at this chart. In the first month of Massachusetts enrollment, only 3% of the total signed up, 123 people. But there's a fast ramp up over the course of the enrollment period. We're going to see the same thing here. It's always been predicted. This is how it works. People wait until they are forced to buy insurance, and then they will.
Well, you use the right word. They're forced to buy insurance on it because this is a new day for them.
Because there's a deadline.
Well, there is a deadline, and the federal government's coming in saying, I'm going to fine you and punish you if you don't purchase the product that we like. In my state, we've had thousands and thousands of people that have gotten letters to say you're canceled. Because of the Affordable Care Act, this policy is no longer available. And it's not just individuals, it's companies as well. The Oklahoma City Chamber of Commerce, for instance, they have about 1,500 small businesses that get their health care through this group set. Well, that group said is no longer legal. That's now illegal in the Affordable Care Act for chambers of commerce all over the country to actually help provide small businesses a way to be able to get insurance. All of those are out, have to get out. So this is not some little plan out there for this individual that wasn't enough for the federal government. These are lots of small businesses all over the country that are losing their health care coverage. As of today, when we got to the hearing, I asked directly today some very sharp folks that are from the IT world that are working on this right now. But Todd Park, who's leading this from the White House, could not answer me today whether by the 15th of December they'll have the website ready. So this is not just a matter of a slow rollout. This is not even available.
Well,
so those that have lost their
coverage, made it clear that by the end of November, most people would be able to use this website.
Well, what's interesting about that is I asked that same question today. I know that Jeffrey Zients has said that publicly, but when I actually asked the IT people, or when I asked the IT people that are actually running it and actually have to do the coding, they hesitated and said, that's our goal, but we can't guarantee we're going to have it ready by the 15th.
We're going to know this very soon. So here's a question for you. That we're going to know this very soon. It's the reality. And we hope the website will be working. God knows that we wish we weren't in this position.
5 million people have lost their insurance. However, if they don't have it by January 1, they're not covered. And Obamacare that was created to cover people actually has created 5 million people uncovered.
Well, let me ask you, my colleague, something. So Oklahoma didn't make its own exchange.
Right, and we have 346 people that were able to sign up in Oklahoma last year.
And you know what? And that's a problem. You know, that is a problem. I mean, there were states, again, I'm so fortunate to be Californian because we want to make this work. We want people covered. We want people to go in for preventive care. We want to find things early because it's a lot cheaper for us to treat it there than at the hospital rooms. You know that. We know that. We're bending. We're trying to bend that line. Unfortunately, and, you know, your Governor Mary used to be a colleague of ours, and I worked down the gym with her in the mornings. And so it's really sad that your legislature and or your governor, or however it works, decided not to put up their own exchange. So now it gets pushed to the feds. So the first problem is there are a lot of people who are sort of dragging their feet, not wanting this to work at all, and that's a shame. But the second thing, and I agree with you, this website should have worked correctly.
Right. But
no doubt about it.
Let me say one thing on that.
Should have worked correctly.
I absolutely agree, and that's the reason we had the hearing today. It's basic oversight. When there's something in government that absolutely doesn't work as promised, we should do oversight. And I know everyone wants to look at it and say, this is a partisan, I can't believe we're doing this. But if you spend $600 million to create a website and it doesn't work, I think probably we should ask the basic question of that. And in Oklahoma, we have something called Insure Oklahoma, where we've been ramping up for years to take care of those that are uninsured in Oklahoma. We've now been notified by the Obama administration that that program is no longer eligible. We have to substitute their program instead.
Well,
so it's not a matter of our state.
Substitute their program.
Oh, yes, we do.
You could have put in your own exchange.
No, that's actually not true.
We put in our own exchange.
I understand. If we did an exchange like the Obama administration wanted us to do it, we could do it. But if we had our own system to take care of those in need, small businesses that want to get into it, individuals that couldn't afford policies, those in poverty, then we were told, no, you can't do that anymore. You have to switch to our program instead.
I think we want to standardize it as we go through the process.
That's the problem. From the central government to standardize everybody, that's our problem.
Let me just, without noting that Orange County and Oklahoma City are different, let me just suggest that.
But a lot of people from Oklahoma settled Orange County, by the way. We have had strong ties here. So
on Friday, a historic vote is going to occur. Next, I'll give you a political scorecard with 3 numbers. They're all you actually need to look for, and it will tell you everything about the political reality here in Washington this week.